Hello, this is Dr. Paula once more. I'm coming to you from location. Today I'm attending the Breast Health Collaborative of Texas, and there's some very important people on site that I wanted to bring you a little bit of what I have learned at this summit today. But I also wanted to bring you a few testimonies of people who have been through breast cancer and who are also involved in really important projects in the community. Today I'm speaking to Miss Patricia Jones and Miss Corina Ramirez. They are both breast cancer survivors. They will tell you their story. They'll also tell you the things they are involved with and how you can benefit from it. So please take a listen and pay attention to all the information they're going to be bringing you, and if they give you any phone numbers, you need to write it down and make sure you are making good use of these resources in the community. Here's Miss Jones and Miss Ramirez.
Hi, good afternoon. My name is Pat Jones. I am a two-time breast cancer survivor, thriver. I was first diagnosed in 1992. I actually knew before I was diagnosed, but because of fear that I tell women, that's our number one cause for not saying anything. I felt a lump, but it didn't hurt, so I didn't think anything was wrong. I thought it was fibrocystic because I had had that before, so I didn't go to a doctor. I was not 40 yet, I was in my 30s, so it wasn't time for me to have a mammogram. A girlfriend of mine, at a pajama party, I confided in her and she wanted to examine me, and she did the next day. She brought me to her doctor. She just happened to be a physician assistant. God has a sense of humor, and he always has a ram in the bush. So I went, they did the diagnosis, they did the study. I ended up with a biopsy. Lo and behold, I never wanted to hear that man told me I had stage 2 breast cancer. Again, I tell women, what would have happened if I would have gone when I first found it? I ended up having a mastectomy and what's called a tram flap. And that's, in layman terms, a little tummy tuck where they took the tissue from my stomach and made a mound because I was a little, I didn't want to wake up one-sided, let's put it like that. Because it does affect your, I'm less than a woman, I'm not going to feel right. So I had the surgery, I had 6 rounds of chemo. Believe it or not, I didn't lose my hair, I didn't get sick, I didn't even lose weight. And I was on Arimidex for 5 years. Lo and behold, 2002, I go back to the doctor, I have another exam. Guess what? Cancer struck his ugly head up again. This time it had metastasized in my lungs and some in my liver. So I am what you call a metastatic breast cancer survivor. I'm still on treatments. I went on chemo again. This time I did lose all my hair. So I learned how to make beautiful scarves and do makeup. You know, it's all in your attitude. It's all in your attitude. I may have cancer, but cancer does not have me. I give all power to God who saves me. So today what I do, I still do treatments every 3 weeks. I am now, thanks to researchers, on an oral pill that's called Curb, and it's chemo. So I go out. I am an outreach coordinator for the Galveston County area. I go out and beg women, if I have to, at health fairs, food fairs, on the street, to get mammograms. There are free services everywhere. No woman needs, in this day in 2019, die from this disease. You can go to the Rose, UTMB, Coastal Health and Wellness. We have free mobile mammograms that meet. We give free, the word is F-R-E-E, ladies, free mammograms. And you can get them, and it's still hard. I got 20 women. Out of those 20 women I signed up, only 9 showed up for a mammogram. That's unacceptable. So please, if you don't know anything else, please use your voice. Please share. Please get your mammogram. know your girls, know your body. Anything you see wrong, speak up.
Yes, Miss Jones, what would you tell the lady who knows that she has something wrong but she's afraid or she says nothing about it?
I would tell her, walk through the fear. Walk through the fear. Talk about it. Bring someone with you. If you see anything different, it may not be a lump. It could be a rash on your breast. It could be an inverted nipple. It could look different, size. Talk to someone. Immediately call.
Thank you so much, Ms. Jones. We appreciate you, and we know that your message is gonna really help someone out there who is afraid of coming out because she has some kind of symptom. Thank you so much. We appreciate it.
Thank you so much.
We also have Miss Corina Ramirez, who is a breast cancer survivor herself, and also she's involved with a very, very important community resource in the Galveston area. And I would just like to bring you her story and let her tell you herself, what she's been through and what she's involved with currently. So thank you, Ms. Ramirez, for coming out. Can you tell our audience a little bit about your journey as a breast cancer survivor and what you are involved with currently?
Yes, of course, that will be my pleasure. My name is Corina Ramirez. I was born and raised in Peru, and I made USA my home 31 years ago. 4 years ago, I found that I have cancer, breast cancer, and after 6 months of chemotherapy, total mastectomy on the left side, and 54 radiations, I am still here and I'm ready to complete my 4 years as survivor. Before cancer happened, I used to work in the community for 28 years as a referral specialist, as a caseworker, as a family service assistant, and I always been in the other side of the table, giving refers, advices, presentation, how to prevent breast cancer. Now I can use my professional experience and my personal experience as a patient, as a survivor, to help the community. At this time, I still being a community health worker. I still having my licensing. I still helping and advocating for my sisters with breast cancer.
So tell us what you are involved with at the moment. I know you are involved with a very important project in the Galveston area.
That is correct. I always work with the Galveston County, also with the Harris County, and I try to help all the patients that they are going to attend to different clinics. Sometimes they don't have nobody to advocate for them. That way they call me, they get in contact with me, and I can refer them and advocate and provide transportation sometimes.
So can you tell our Hispanic community in Spanish what is available for them in your little project that you're doing with Galveston? Can you tell the Hispanic community?
Claro que sí, con mucho gusto. Mi nombre es Corina Ramírez, sobreviviente de cáncer al seno por 4 años. He estado 28 años trabajando al servicio de la comunidad en diferentes agencias, ya sea el condado de Harris o el Gold Coast Community Services Association. En este momento sigo trabajando como Community Health Worker, apoyando a mi comunidad de cáncer al seno y dándole referencias de dónde ir, ya sea en el condado de Galveston o el condado de Harris, dándoles apoyo, ya sea de transporte cuando alguna vez se lo necesita, y tengo mis propios proyectos personales, como por ejemplo en la comunidad peruana, el Consulado General del Perú tiene un departamento que apoya a la gente dando referencias a través mío y organizándolas para que puedan aplicar a diferentes programas.
Thank you, Mr. Ramirez. Tell our Hispanic community, tell the lady who's out there who has a symptom, thinks it might be breast cancer, but is afraid of coming out to seek, treatment or to find some resource in the community. Give a little bit of advice in terms of what she needs to do.
¿Cómo no? Lo primero que uno tiene que hacer, sin mucho miedo, es hacer su chequeo uno mismo cada mes. Es importante hacer la mamografía una vez al año, porque uno tiene que saber qué cosa es normal, para que cuando aparezca algo, uno sepa que no estuvo ahí la semana pasada o el mes pasado. Si nosotros en ese momento recurrimos al médico, como fue mi caso, podemos salvar nuestras vidas. Hay muchas referencias. Tenemos el servicio del 211, que es la oficina de la United Way, donde nos atienden en español y nos pueden decir a dónde ir y a qué centro podemos ir a buscar elegibilidades para diferentes servicios que son gratuitos. No hay que tener miedo. Uno tiene que seguir adelante y como buenas latinas, como buenas hispanas, sacar la fuerza adelante.
Thank you, Ms. Ramirez. Is there anything else you would like to tell our viewing audience?
Yes, I would like to say this. Being a breast cancer survivor, I know it's difficult, but not impossible. Me gustaría decirles, como sobreviviente de cáncer al seno, que quizás es difícil, pero no es imposible. Gracias.
Thank you so much. We appreciate it, and we wish you all the best in everything that you do. Thank you.
Thank you.